Hi, Amy, welcome. Thank you so much for joining us for our Community Partner Showcase interview today. I'm so excited about
Thank
this
you. Thanks for
interview.
having me.
Yeah, I'm really excited because I think your agency provides a very unique and important service and not enough people know about it. So I think that it would be really valuable for us to find out more. So thank you.
Great.
Yeah, so I
Yeah.
know that you work
Happy
for
to be
the
here.
Hassle-Free Clinic in downtown Toronto.
Yes.
Can you tell us more about what your clinic provides?
Yeah. So we're a sexual health clinic, and we provide STI testing, HIV testing, and also reproductive health education, and also provide, for example, birth control pills or other kind of birth control methods for people. And yeah, and then also just education around safer sex, sexual health, and also counseling around sexuality, sexual health.
Mm-hmm.
I think one of the things that's unique about it is that we really believe that it's sexual health should be. We want to make sure the reason that we call it hassle free is to make sure that we really minimize the obstacle for people and to make sure that everybody can access our service. So that because of that, we don't require any kind of health, like we don't need OHIP for people to access our service. Yeah, so anybody can come,
So
and there's no charge.
great. Yeah, because we know that some of our community members doesn't really have full health insurance, like students
Exactly.
or migrant workers, and so that would be great if they can access your services.
Yeah, yeah, anybody is welcome. Yeah.
Yeah, but it's also that is really more like a sexual health treatment and assessment clinic, right? So it doesn't provide ongoing health service like a family doctor type of services.
Yeah, no, it's not a family doctor. We still really encourage people to have family doctor. But I also know that sometimes with their own family doctor, they might not feel as comfortable doing pap tests for women, for them to do pap tests or other kind of infection checks. So they're more than welcome to come here if they want to do sort of the pap test or sexual health examination with us. Yeah, but we don't really provide anything beyond sexual health.
Okay, so like you don't like manage people's like high blood pressure or
Nope.
diabetes or other chronic health conditions,
No,
right?
no, we're just a we're just a sexual health clinic. Yeah.
Yeah.
But
So
we'll try our best to help people connect with those services if they don't have a family doctor. Yeah.
Yeah. So how long have you worked there, and what is your official role at the clinic?
Well, I actually have many different roles over the years. I started working here in I think 2000, so this is my 20th year, I think.
Oh, yeah.
Working here. So I used to be mainly in the women's clinic as a sexual health counselor, and then since then, I actually now my title now is actually the Making Your Links program manager. So it's my role now is mainly with the men and trans clinic, where it's more around sexual sort of the counseling piece, and it's connecting people to who tested positive for HIV to care, and also any kind of sexual if there's any kind of mental health piece. I'm also here to help people with that. So I'm actually a therapist now, and in the sort of an in-house therapist.
So you would provide mental health counseling and support to people, right?
Yes.
So that's great. And linking people to care. So even though your clinic doesn't provide ongoing primary care, you do try to connect them to the services people need, right? So that's really important. Great.
Yeah.
And I know that, like besides yourself, I know you speak Mandarin and English, right? So besides yourself, is there any other staff who speaks Mandarin or Cantonese or other Asian languages?
Right now, unfortunately, it's just me. We used to have other staff that can speak Mandarin or Cantonese, but right now, it's just me. I can speak Mandarin and I can speak some Cantonese as well. At least I can understand probably most of it, but yeah.
So if people doesn't speak English and you're not around the clinic, how do people access the services?
Well, so the good thing right now is because everything, because of the pandemic, everything has to be by appointment. So it's actually easier for us to plan ahead. And so if people need to access service in Mandarin, then I'll just make sure that I'll be available. We'll book a time when I'll be available as well.
Mm-hmm. Yeah, and then like the clinic also have different hours for men and women, right?
Well, we used to be for like 30 years. We have separate hours, but because of the pandemic, we actually merged the hours. So now we're all gender clinic. Yeah,
okay.
yeah. So it's just one number, and you call us, and we'll. And another thing, maybe that's later on you'll ask me that question, but I'll just tell you that because of the pandemic, everything is by appointment. We used to be a drop-in clinic, but now because of the pandemic, everything is by appointment. So you always for people to access our service, you have to call us first, and then we'll book the appointment. Yeah.
So what opening hours do you operate?
So right now we're operating Monday to Friday from 10 to 4, and then Saturday from 10 to 2.
Okay. So if people wanted to make an appointment, they can call and then somebody will answer or can they book it online or?
Yeah, no, not online. No, we don't, just because we have so many, depending on what they are here for, there are a lot of different questions that we have to ask. And also because of the screening, we also had to ask those questions as well. So no, it's only people would have to call.
So do people need to call within the opening hours or can they leave a message or?
No.
Okay. Yeah.
Yeah.
So I know that a lot of services has been affected, right? And I know that you talked about your mode of service delivery has changed from like more drop-in to appointments only. Is there some other ways that your services have changed? Are you able to do more like remote services like some of the other community services?
So yes, and so the other thing is that we are doing more remote services. So for example, any counseling that I'm doing is all remote. So it's because when we're in the clinic, we all have to wear a mask. And I think with counseling, it's so important that we can, see each other's facial expressions. So actually, a lot of the counseling part or even birth control methods, education and things like that, we have moved it online now. So we'll book the appointment and then a counselor will meet with you online.
But for actually diagnosing or treating infection, then you need to see people in person, right?
Yeah, depends. For a while, sort of in the first wave in the beginning of the pandemic, doctors were actually using also just remote online service. But then, of course, when there's certain, like certain things, they do have to come in to get tested and do sample. Yeah.
But there's a lot of educational, informational, and counseling stuff you can do online, right?
Yes, exactly.
So do you do it through phone or on video conference as well?
Video conference. I mean, we can do phone as well if that's what clients prefer, but we find that the facial kind of interaction is also more engaging.
Yeah. Especially for counseling, right? Definitely. Yeah.
Yeah.
So how have the needs of the communities that you serve changed since the pandemic, like from what you've seen from the front line? Are you seeing more infection, more distress, or
I think there's always this we're definitely seeing a lot more mental health issues that are also coming up, and I guess a lot of I think in terms of mental health, like people who are who are more isolated tend to be, we can find that we find that their mental health is really affected by this, and sometimes we have different coping strategies, right? So when we're feeling lonely, we might try to cope by having more sexual hookups or things like that. And so that's one of the way that we're finding that a certain group of people might kind of cope this way. And then there are also other people who are, instead of we're also finding that there are other people who choose to be more have more social distancing dates, and they're actually experiencing dating in a different way. So it's very interesting how this is all changing. What was your question again? I just want to make sure I answered that.
So I just wanted to know, like, from your frontline experience, have you seen a lot of changes in the needs of the people you serve, right? You seeing more infection? Do you see more domestic violence, or do you see more mental health distress? Or because we heard about some of those, right?
Yeah, I would say all of the above. Yeah, definitely a lot of mental health, feeling lonely, feeling isolated, feeling and also some domestic violence as well. Yes, for sure.
So what kind of tips or advice would you give people about, like, meeting sex partners or having sex more safely in the context of the pandemic? It's $1 million question.
It's really, really tricky. I think, how do we, even if we cannot physically, if we choose not to physically meet with each other, how do we still stay connected with people? I think it really changed how we look at, casual sex, and how do we know each other, and really, and before we always ask people to, get tested before we, become sexually active with each other. And, and that's still true. And then we add the risk of COVID, right? And how do we make sure how do we assess each other in terms of our COVID risk, so that, when we get to know each other, we are still protecting each other from exposing to other people. So that I find that really tricky, but it's the same idea that we just really encourage people to we still encourage people to get tested before they become sexually active, but also, in terms of getting to know each other, I guess if we can start with social distancing, getting to know each other, and then gradually make sure that we're not keeping each other in a certain bubble. But
this is really tricky and challenging, isn't it?
Yeah. And I think if, and there's also a lot of people that choose not to be sexually active because of this, and I think that that's also really understandable. The only thing we want to really encourage people is that even if we're not being sexually active, it's still really important that we stay socially connected with people, because what we're also finding is that then people feel so isolated and so depressed and anxious, and sometimes some people would then, because of this, cope by saying, "Oh, forget it, just I'll just go and hook up with someone because it just it's just so there's because it's so isolating." And we're human beings, and we're built for connections. And so when COVID kind of cut all of that, and it's really really difficult. So it's really important that we find ways to stay connected with people, even if it is not sexually.
Mm-hmm. Yeah, so I think it's kind of a really unfortunate term they call social distancing, because we are really talking more about physical distancing.
Physical distancing,
right?
yeah,
so
exactly.
we should really remain socially connected to
Yes.
support our mental health and all that, right? So I think that's really important. Yeah, thanks for reminding us. So is there other information or suggestions you would want to give and share with our audience before we sign off?
No, just I think that's it. But yeah, I mean, the only way to access our service is by calling us and book an appointment. So I don't know if there's going to be like a website with our phone number on it, or I can also just let people know our phone number.
Yeah, we'll put your website and phone number as a subtitle to the thing. Yeah.
Okay.
So that's great. So thank you so much for spending time with us, and hopefully, our community members who needed the service can access and, meet with you. Thank you.
For sure. Yes, I'll be happy to. Yeah.
Great.